Hello, my name's Scott, as you know, and this is McKenna, Olivia C, and Olivia T. Our case study was on a gentleman by the name of James from Portland, Maine. So, a little backstory on James. He is 28 years old. He is an African American male. He was diagnosed with paranoid schizophrenia at the age of 19. He has no contact with his family and hasn't for a very long time. He has been homeless for many years as a result. He lives on Preble Street. He lives on Preble Street in Portland, Maine. He is on and off with his medication due to the fact that he thinks the government is both watching him and poisoning him with the medication. He dumpster dives for food, and he currently has a dental infection. He is dehydrated and malnourished from an attack he was involved in involving several teenagers who decided to beat him up for some reason. It's not really something I condone, so nothing that should be, yeah. So anyway,
So, right off the bat, we should go through some approaches to dealing with James's case. Um, First off, I think a case manager would be most beneficial. Um, so we were thinking about having an ACT team. Both an ACT team and a case manager are very similar in terms of goals and everything. The main thing is I think an ACT team would overwhelm James, especially if this is right off what we're jumping into. He doesn't trust anyone, and due to his symptomology and his inconsistency with his medication and his level of paranoia, I think it's best that we start off with a case manager and see how that goes. Because a case manager is still very highly individualized and very personalized. A case manager will monitor and advocate for and evaluate James. They can help find agencies and other resources needed for him. And along the line, they'll assess progress, abilities, and goals of James. And they can even do a locus assessment if they're trained. So that would help him with applying for insurance or housing or things like that. Um, so, another model to look at would be the psychiatric rehabilitation integrated services model. I think what we really need to incorporate into James's environment is just the inclusiveness in the plans and the meetings, whoever it may be with. I think it's best for him to be included just to establish that trust. Um, so this model will emphasize the goals, the skill development, and the external supports he has and can get. Um, it's very person-centered, and also this plan can even involve family members if the patient wants. So that's something that we're going to have to talk to James about, just because, as far as we know, he hasn't seen his family in years. He has been homeless and has not been in contact with them at all. So we don't know why that is. So down the line, it is totally up to him. It's his choice if he wants to involve them, if he wants to get those supports eventually. Um, One last thing is to gain some leverage as soon as we possibly can. This is more just to really establish that trust and gain some trust from him so he'll feel more comfortable with that. So I think if we do some dentures or some dental work, he will be more trustworthy just because if he has dental infection, he needs to eat every day. And I think if we get him dentures and get him main care and social security income, that would help him a lot and benefit him right off the bat. So
All right, so the first step for James right off the bat would be getting him a case manager assigned, and he can get a case manager assigned at Preble Street Resource Center, which he already spends most of his time at. It's where he usually resides. And after receiving his case manager, he can work at applying for SSI at the Social Security Administration office that is located in Portland. That way he can work on getting the money needed to pay for his medical bills after having been hospitalized. And a next step would also be applying for Medicaid and Medicare, which can help with further medications or dental treatments or just further hospitalizations that he may have. So the reason he would need to apply for MaineCare and Medicare is because he does not have previous insurance, especially as a 28-year-old male, homeless male. He is malnourished, he is dehydrated, and he has dental issues, and MaineCare and Medicare will help assist him in further treatments and hospitalizations and all the dental visits he may have. And Social Security will help assist in later transportation that he may need or appointments and just paying for his daily life while he is unemployed.
So these were just some mandatory Medicaid benefits if he receives it. Just wanted to quickly highlight basically what would be useful for James. So he would get inpatient and outpatient hospital services. He could have physician services available, laboratory and X-ray services, and I think transportation to medical care would also be a big one. And those are all some things that he could benefit from if he gets it. Okay, so for dental leverage, we're looking mainly for dental clinics in Portland because especially if James initially is unaware of how the transportation and bus system works, we need to make it as easy on him as we can. So with that being said, if he's given MaineCare, James will still have to pay some fees for initial x-ray exams and cleanings before he can even do dentures or partial dentures. And dental care for adults under MaineCare is usually really limited. So we expect for him to not get reimbursed that much for whatever he is given. So I think that Social Security income will benefit him the most paired with the MaineCare because usually the cleanings and everything, those are on average between $60 and $90 a pop. So that's going to be quite a hefty expense, especially if he has to do that multiple times before going for those dentures. So yeah, that would help a lot. So we looked into a few. The Portland Community Free Dental Clinic, that's a 17-minute walk from Preble Street, and Greater Portland Health is actually on Preble Street. So these two clinics definitely do those initial x-ray exams and cleanings. And despite our communication efforts, it's not positive whether they do dentures or partial dentures, but we know that the UNE Oral Health Center does. So the only issue is that it's in Portland, but it's an 11-minute drive. So that would be a 55-minute walk for James. So I'm thinking to work around this issue, we could either have the case manager go with him and drive with him, or he could get a free bus pass from Seeds of Hope. Another option would be for him to actually use some of his Social Security income to pay for a bus pass just to get over there, because they definitely do dentures and partial dentures as well as the x-rays and cleanings and all that stuff.
All right. One big thing that James had a problem with was that he would often dumpster dive for food. That was his main source of nutrition. So right here, we laid out a calendar with all of the food services, such as food pantries or food banks and soup kitchens. Just to lay out all of his options to let him know that these are what are available around him. All of these listed are just in Portland alone. So if he were able to be transported to other places like Biddeford, where Seeds of Hope is, that opens up a lot more options for him in terms of food. It's important to note that the better food that he eats, the better dental hygiene he will have. So that's very important in terms of his physical health. And again, ties back to the leverage that we can use to get him to trust the process and that we are here to help him. Having all these options also puts James in control, and especially after he gets the dental care he needs. There are many listed that actually supplies fresh food, such as vegetables and bread. All these are near Preble Street or are even mobile services. A lot of them right now are operating under COVID hours and regulations. So some of these may change after COVID. So that's something that might be altered once the pandemic subsides, in terms of hours and their pickups. And referrals, which right now none of these need referrals for. Normally a case manager would refer their client to the food services to make sure that they are actually in need of food. But as of now, no referrals are needed. But if that does come to something that he would need, the case manager would be able to write that for him. And in terms of medication, we know that he right now is very non-compliant with his medication schedule. He is often on and off his medication, and we want to talk to him and figure out why he is coming on and off of them. If it's something as simple as a side effect he doesn't like, or if he feels groggy on a certain medication, having him in control of what he is putting into his body may help build that trust. And decrease that paranoia that he is being poisoned by the medication. There's many different evidence-based medications to target symptoms. There's antipsychotics, which are traditionally used for schizophrenia, but there's also antidepressants, which they can target the depressive symptoms. And there's medications with tranquilizing properties that can help subside the hyperactive symptoms that would be prescribed briefly, not for a super long time, but just something to give him the option for. The Preble Street Resource Center, which works with the homeless population, has a medication-assisted recovery program. This is traditionally used for substance use disorders, but can also aid pairing the medication with his mental health counseling, which we would think is the best for evidence-based practice in terms of his conditions. So again, finding someone that he trusts, and even if you trust the resource center in general, that would be highly beneficial for his treatment plan. But it's not limited to that. We could find another psychiatrist, since his medication and visits would be covered by Medicare and Medicaid.
So in terms of mental health care / therapy, it would definitely be paired with medication assisted programs, because medication works well, mental health care works well, but they work best in tandem. What we want to explore with that is familial support, because again, he hasn't had that much contact with his family in a while. So depending on the history of that, we want to figure out why, like, why is he not in contact with his family? Where are they? Or like, where were they last located? What can we do to try and fix that? That could also contribute to relationship building skills, because if he's not with his parents or his family, or has no contact with them, it makes it very tough to build more relationships as a result. And with that, maybe reconnecting with his family, so that way he can have those connections and that familiarity that he had growing up, theoretically. Some good management training with the illness is basically just psychoeducation, which is just making sure that he knows the nature of his mental illness, its characteristic symptoms, effects, and side effects of the medications that he would be taking, the principles of treatment, the management of stress, and the early warning signs of relapse. So that way he is prepared for whatever schizophrenia has to throw at him. Next slide. Taking it back a few steps to transportation, because we have brought up Seeds of Hope a good bit, because haha, internship there. Some good transportation would be the caseworker. They can drive James to certain places depending on how available they are, as well as the usage of that Social Security income to pay for bus fare or bus passes. That way he can get out of Portland, away from Preble Street, and able to access more resources as a result. One specifically is the BSUB bus network, excuse me. It can travel from Portland to Saco and all towns in between, like Saco, Old Orchard Beach. I said Saco already, excuse me. Scarborough and Biddeford specifically. Because in Biddeford, if you take the Green Line from Portland to the Saco Transportation Center, about a 10-minute walk from that is Seeds of Hope, where it provides a ton of resources for people experiencing homelessness, including food, clothing, more bus passes, opportunities to get careers and build resumes and whatnot. So, again, I could go on for hours. However, another good approach for this would be vocational rehabilitation, not supportive employment, because vocational rehab is much less intensive and much less non-committal. So this would work a lot better, so that way James is not too overwhelmed, because while we do want him to get more trustworthy of the government and society as a whole, it's going to take a long time. So starting from the bottom per se would be the best route to take. Specifically, Maine Vocational and Rehabilitation Associates, or MVRA for short, located on Preble Street, oddly enough, offers career explorations, job shadows, situational assessment, job development, job coaching, and long-term support. I do recommend that he goes to Seeds of Hope first, because he can get clothing, so that way he can properly job shadow and just look like he fits into the whole crowd. So yeah, next slide.
An important step for James also working with his case manager would be housing, as he is homeless in Portland. It's very dangerous. As we can tell, he has been attacked randomly by some teenagers and ended up in the hospital. So housing is a serious issue that James needs to take focus on. And so with his case manager, they can assess him for a locus score, which will help him in determining if he is eligible for Section 17 housing. And so based on our own assessment of James, we have given him a locus score of roughly 23, and possibly that may differ from with his case manager, but this gives us the hope that he is eligible for Section 17 housing based on his locus score, because it's over 17. He is over the age of 18. He does not have a co-occurring substance disorder, and he has a serious mental illness. So for that reason, he would be eligible for a Section 17 housing. But in the meantime, while he is working through his therapy and getting on a new medication, if need be, he can stay in the Preble Street Resource Center, because it does offer many services that he would need help with, and his case manager would be located there. So that would be a great option for him in the meantime while he is waiting for housing. But a good place for supported housing for James would be the Portland Center for Assisted Living. They offer multiple services that could benefit James in multiple aspects, including individual care, which includes his self-care and medication administration. So they would ensure that he stays on his medication and does not just stop taking his medication for any symptoms that he may be having. They also provide domestic services like housekeeping and laundry, so he would be ensured to have clean clothing and prepared for his job. And they also offer dining, 3 meals and snacks are offered, so he would not have to miss a meal and he will not be malnourished there. And they also provide just wellness services like entertainment. They go on outings, they have a library, and they also do arts and crafts. So it builds on his social aspects and can help him with gaining trust in others, since he has been paranoid and he does not trust the government right now and he believes they're poisoning them. So having those options will help him build trust with others other than just his case manager and his therapist or psychiatrist who's working with, and it'll help him build trust in the community again, as well as providing him a home.
Okay, so just to wrap some things up, we want a few goals to come out of this for James. We want James to start gaining trust in others, even if it's just a little bit, even if it's just one person, and go from there. We want him to have a roof over his head. We want him to get the physical and mental health treatment that he needs. Another goal is just reintegration into society. We want him to feel like he's a functioning part of society again. And one of the biggest things I think is support. He should know that his case manager and everyone he works with, his family, if he decides to reach out, like these are support systems that are there for him. We're going to support his decisions. They're going to support his future, and then they're going to be there along the way. Whether he's doing worse, doing better, I'm sure it's a long road. It's a roller coaster, but he has supports that are there for him along the whole way.
That was more than 20 minutes. We're good.